Hi, my name is Rachel. So you're going to have an operation? I had one too. If you're like me, I bet you'll have a lot of questions. We made this movie to help you understand what will happen when you come to Duke Children's for your operation. If you still have questions after you watch this video, it's a good idea to ask a big person, like your mom, your dad, a nurse, a doctor, or a child life specialist. When I was at my doctor's office, he told me a part of my body wasn't working quite the way it should, and that I would need to have an operation to fix it. He told me that I would get special sleepy medicine to help me stay asleep during the whole operation. He told me I would not feel anything and would wake up when the operation was over. Boy, was I glad to hear that. The week before my operation, I came to Duke Children's for a checkup and screening test.
I want you to try.
I met with a child life specialist who used a doll to explain what would happen during the operation. The night before my operation, I packed a bag with a few of my favorite things. I decided to bring my teddy bear, my skunk Stinky, a couple of books, and some clothes to wear home. My doctor told my dad I couldn't eat or drink anything after bedtime. He said I would be able to eat and drink again after the operation was over. The morning of my operation, my mom, dad, and I drove to Duke Children's Hospital. We took the elevators up to the check-in area. A nurse showed us to a room where I changed into a hospital gown. The nurse also weighed me and measured how tall I was. Next, we went to the holding room where a nurse measured my temperature, blood pressure, and listened to my heart with a stethoscope. Pretty soon, a doctor called an anesthesiologist came into the room.
Hi, I'm your anesthesiologist. I'm the one who's going to give you the sleepy medicine called anesthesia. You can have it one of two ways. You can either get it through this mask called an anesthesia mask, or you can get it in your vein through an IV catheter. And if you choose the vein, what I'll do is put some white cream on it so that you won't feel the catheter going in. What we'll do then is have you go to sleep, and after you're asleep, you won't wake up until we're all finished and we turn the medicine off.
I decided to get my anesthesia from the mask. When I'm sound asleep, my surgeon will start the operation. My anesthesiologist said I will stay asleep during the whole operation and won't feel a thing. When the operation is over, she'll stop giving me the anesthesia and I will wake up. I rode into the operating room in a wagon. Some kids get to ride in on a bed with wheels called a stretcher or even walk in. My mom came with me, and I brought Stinky too.
Okay, Mom, this is where the mask goes up.
I noticed that all of the nurses and doctors were wearing hats, masks, and gowns to keep their germs away from me.
Here we go.
There.
Even my mom had to put on special clothes. She wore a white paper jumpsuit, hat, mask, and blue shoe covers. I thought she looked really funny. When we got to the operating room, I sat in my mom's lap. The anesthesia nurse put a small sticker on the end of my finger. It had a red light in it. It was connected to a special machine which made a beeping noise. It told the doctors how much oxygen was in my body.
Okay, Rachel, remember that mask I showed you in the other room? This is
The
your mask.
anesthesiologist slowly placed the anesthesia mask over my nose and mouth. She told me to take some slow, deep breaths and blow into the mask.
Very good.
When I did this, I breathed in sleepy
And you
medicine.
can just take a nice nap, and when you wake up, your mommy and daddy will be right there with you again, okay? Good girl. You're doing
It smelled like strong perfume. Pretty soon, I was sound asleep. Once I was asleep, the nurses moved me onto the bed.
Why don't you go and pull your mask down, give her a kiss, and Marge will show you how to get out of here. We'll take good care of her. We'll see you in the recovery room.
And my mom went out to the waiting room with my dad. When the operation was over, the nurses and doctors moved me to the recovery room. I was still a little sleepy from the sleepy medicine. My mom and dad came into the recovery room to stay with me. I sure was glad they were there. After a while, I wasn't so sleepy anymore. When I started to wake up and look around, I noticed I had some tape on my hand.
Yes.
My nurse told me this was my IV.
Surgery, and it's feeding you really nice liquid to make you feel better. And it's connected by this tube all the way up to this bag.
Special fluid that looked like water dropped through the tube and into a vein in the top of my hand. The doctor had put the tube in while I was asleep during my operation. My IV did not hurt, but the tape was a bit uncomfortable. I was a little sore where the doctor had operated on me. I told my nurse and she gave me some medicine to help the hurt go away. My mom also held my hand and talked to me, and that made me feel better. Pretty soon I was able to drink some juice and eat crackers.
Before you go home, I need to take your IV out. And here we go, 1, 2, 3.
My nurse took the IV out of my hand and put a Band-Aid where the IV had been.
Terrific. Yay. Now today.
Pretty soon, the doctor gave my nurse permission to send me home. The nurse told my parents how to take care of me at home. I noticed that some kids didn't get to go home the same day of their surgery like me. A nurse told me that sometimes kids need to stay just overnight. Others have to stay a few days. Your doctor will decide how long you have to stay. Your mom or dad will get to stay overnight with you. When you are better, you will go home. I got to ride in a wheelchair to meet the car. When I got home, I rested for a couple of days. I was still a little sore. I watched TV, played video games, did some homework, and took it easy. Before long, I was back to my usual self, going to school, playing with my friends, and eating regular food. I was glad that my operation was over and thought the nurses and doctors at Duke Children's Hospital were great.
Be sure to pack a change of clothes for your child and yourself, just in case you have to stay overnight. Bring a few security objects for your child, such as a pacifier, a blanket, stuffed animal, or favorite toy. Be sure you arrive 1½ hours before your child's time of surgery. If your child is currently taking medicine, be sure to talk with your child's surgeon and anesthesiologist to see if your child should take the morning dose. Remember, do not let your child eat any solids after midnight the night before surgery. Your child can have clear liquids up to 2 hours before your arrival at the hospital for surgery. Remember, that's 2 hours before your arrival time, not surgery time. Before you are discharged, your child's nurse will provide special written instructions on how to take care of your child at home after surgery. He will discuss your child's diet, activity level, and medication.